Hi, I'm Jeremy Ross and I want to talk about integrative Chinese medicine, a new system for diagnosis and treatment. This video is divided into two parts. The first part is the integrative Chinese medicine diagnosis, and this part is part 2, ICM treatment. And it's essential that you watch part 1 before you watch this part 2, or you simply won't understand it. So please watch part 1 if you haven't already done so. Now, this is part 2, ICM treatment, and it's divided into 3 sections. The first is differentiating Western herbs. The second is integrating Chinese medicine into this. And the third is integrating phytopharmacology into the system. So, first a little bit of introduction. ICM treatment includes the following modalities: conventional medicine, Western herbal medicine, Chinese herbal medicine, acupuncture, and also Qigong and nutritional therapy, and most important, self-help routines. Now, this video tells the story of how I developed Western herbal differentiation and integrated Chinese medicine into this, and also integrated the modern phytopharmacology and clinical research. We're looking now at differentiating Western herbs. Now, for me, this system of ICM, integrative Chinese medicine, has been a long journey, in fact 45 years to develop it. And it didn't begin with a beautiful vision, it began with sheer frustration. I was trained as a scientist in plant biophysiology and plant biochemistry, and I did research in that topic. I was trained to be precise, I was trained to be analytical, and by nature I was drawn to look for the essence of things. When I started with herbal medicine around about 1974, the books that were available to me at the time really didn't differentiate properly between the different herbs. For example, Rossmorenas, Lavandula, Thymus and Salvia all were said to treat headache. But which headache? When should I use one herb and not another? It's essential because of the problem of herb choice when the practitioner is faced with herbs in the same group, many of which have overlapping actions and uses. This makes it difficult to differentiate between the different herbs that are similar and in the same group, and to choose the right herb for the patient's needs at a particular time. The key question is, what makes herb special? A practitioner wants to know, what is it that gives the herb its unique character and makes it different from other herbs in the same group? For example, if we look at Rossmorenas and Lavandula, they're both in the same plant family. This is the Lamiaceae, the mint family. But although both of them can treat headache, they're really very different, and in fact almost yin-yang polar opposites. If we look at Rossmorenas, we can say it's relatively yang. It's stimulating, it's warming, and it's expanding in its energy. It can help to make a depressed and introverted people happy and social. It helps to make people lively and interesting in an interview, and so they get the job. If, however, we look at Lavandula, which is relatively yin, this is calming for anxiety and worry and fear, and taken before an interview or an examination, can calm nervous people so that they perform better. Also, it generally reduces nervous palpitations and nervousness in general. So now, if we look at integrating Chinese medicine into this, I wanted to know the effects of Western herbs specifically in terms of the Chinese organ syndromes. So Rossmorenas, for example, is relatively yang, and it stimulates the heart qi and the heart spirit. It also tonifies and moves the liver qi, and it tonifies and moves spleen qi. Lavandula is very, very different. In terms of Chinese medicine or Chinese organ syndromes, it calms the heart spirit, it calms kidney fear, and it can calm liver wind. So we can say in summary that Rossmorenas is stimulating, tonifying, and moving, whereas Lavandula is primarily calming. Now, the challenge for me, who was a teacher for many years, is to create a visual system in which the differences between the different herbs are immediately visible to the eye. So I wanted to create a vivid picture for each individual herb, showing what makes it special. And the solution was I created the herb diagrams, and these show the herbs in terms of the 4 imbalances and also the 5 organs of Chinese medicine. The 4 imbalances are the key to the lock. They open many doors. This, the 4 imbalances concept, is the foundation for ICM, Integrative Chinese Medicine system, of differential diagnosis and treatment. So the 4 imbalances and the 5 organs diagram, this is an interactive PDF which you can download from the website, of course, www.integrativechinesemedicine.com. And this includes the patient diagram, which was the subject of the first video, and the herb diagram, which is what we're talking about today. This 4 imbalances and 5 organs diagram is really in 2 different parts. The first part is the central 4 imbalance box, and this is the patient analysed, or the herb analysed, in terms of the 4 imbalances: deficiency, stagnation, disturbance, and excess. This is super important because it gives the clear, simple overview, which is very important if you have a complex patient with many Chinese syndromes. Then it gives the 5 organ boxes, because each of the 5 organs of Chinese medicine, the main ones, can be divided into excess, deficiency, stagnation, and disturbance. And it's this that gives the precise detail of the differential diagnosis. Now, the next slide shows Rossmorenas as an example. It's a blank slide, and we're going to fill it in bit by bit in the remaining slides. So if we look at this, in the central 4 imbalance box is what we focus on in the beginning. The central 4 imbalance box is surrounded, like in the usual 5 elements diagram, by the 5 main yin organ systems. But if you look at the 4 imbalance box, you can see that it has a deficiency box within it, where you have the disorders which you need to tonify. It has a stagnation box, where you have the disorders which you're going to move, and then it has a disturbance box, where you have the disorders which you need to calm. And the 4th one is it has an excess box, where you have the disorders which you need to drain. Now, that's the 4 imbalance box, but that system is duplicated in each of the 5 organ boxes. So if we take the heart, for example, the heart has its deficiency box, where you put the heart disorders that you need to tonify. It has a stagnation box, where you put the disorders which you need to move, and so on. each of the 5 organs. Therefore, you can divide the disorders into deficiency, stagnation, disturbance, and excess. And this is a big improvement, or a big addition to the normal 5-element system. If we look at Rossmorenas and its central 4-imbalance box, this gives a clear and simple overview of this herb. First of all, we say its temperature, and in Rossmorenas is warm. And then we say it's aromatic, bitter and acrid. Those are its taste properties. And now we're going to look at the deficiency box, where here it has 5-star rating, a Michelin 5-star rating for tonifying deficiency. It treats deficient qi for 5 stars. And if you look down at the stagnation box, it's treating stagnant qi again for 5 stars. But if you look at the disturbance box, it's only got 3 stars for calming liver hyperactive yang. Not bad, but not top. So, if we summarize this, it shows that Rossmorenas is primarily to tonify deficiency and to move stagnation, and secondarily to calm disturbance. Now we can look at a comparison between Rossmorenas and Lavandula, and here we can see the differences between them very clear at a single glance. So Rossmorenas, as we've just seen, is primarily moving and tonifying. But look at Lavandula. First of all, the temperature is it's slightly warm, and Rossmorenas is considerably warmer. Like Rossmorenas, it's aromatic and bitter, but it's only slightly acrid. But now look at those star ratings. For tonifying deficiency, 1 star for deficient qi. For the stagnation, it only has 1 star for moving stagnant qi. Look at the difference between this and Rossmorenas. 5 stars for Rossmorenas, for tonifying, 5 stars for moving. The same for totally different for Lavandula, 1 star each. But if you look at the disturbance box for Lavandula, this is 5 stars for calming. So this is what I wanted. A vivid visual system where through those star ratings and the organisation of the boxes, you can see the differences between these similar herbs at one glance. That's what I wanted, and this is what we've got. So now, I should have said that neither of these herbs has much draining action, 1 star each. So now if we look at the full herb diagram, what we have here is the 4-imbalance system is expanded, as I said before, to cover the 5 organ systems, each of which can be described in terms of deficiency, stagnation, disturbance and excess. So we're going to look at the detailed picture of a herb, and it's just like the patient diagram. It's the central 4-imbalance box and the surrounding 5 organ boxes. We'll use Rossmorenas as an example. So here we have the completed herb diagram. We've already looked at the 4-imbalance box. That gives you a clear, simple overview. Now we're going to look at the organ boxes, and those together, the 5 organs, give you the detailed, and this is far more detailed than normal. Each of those organs is divided into deficiency, stagnation, disturbance and excess, and star rated for each one. Now, if we look at the heart, then we see that there's only 2 stars for tonifying heart qi. There are 4 stars for moving heart qi, because Rossmorenas, like I said, it helps to move and stimulate heart qi, and it's expanding. It can treat depression and make people more lively and social and happy. But if we look at the liver box, then we've got for liver deficient qi 5 stars, for liver stagnant qi 5 stars. This is a primary herb for the liver. It tonifies and moves the liver and it can be used for all kinds of liver problems, including bad reactions to drugs. It can treat drug side effects because it strengthens the liver by tonifying and moving. It has 3 stars for liver hyperactive yang, for calming. Now, if we look at the spleen box, a similar pattern. We have 5 stars for tonifying the spleen, 5 stars for moving spleen qi. We have 3 stars for intestines qi disturbance. This means that you can use Rossmorenas for intestinal colic, irritable bowel syndrome, borborygmus, and so on. But 3 stars. So if we look at the overall picture, I forgot to say that with lung and kidney, there are very few stars. This is not a herb for lung or for kidney. What it's important, as you can see, immediately visually see, it is for liver and spleen, and to only a slightly lesser degree for heart. It's a liver spleen herb, it's a heart herb, and it's immediately visible in the diagrams. So I'm very happy with these diagrams. We're always improving them and expanding them, but we have here a system where the practitioner can, at a glance, see what makes this herb special. And when you have 2 of these herb diagrams, or 3 or 4 of them side by side, then you can look at herbs and compare them and see the obvious differences and similarities. Now, these are multifunction diagrams. The same diagram can be used to compare that same herb diagram, either Western herbs or Chinese herbs or acupuncture points or foods or Qigong exercises. Now, we're going to look at the 3rd aspect of this integration, and that is integrating phytopharmacology research into the Western herbal medicine. Now, this I'm now going to say is like a law of the universe, like gravity or any other law in chemistry. Differences between similar herbs are based on differences between their chemical constituents. It's a basic law. Now, if we look at Rossmorenas, in modern research, pharmacology research, Rossmorenas is reported to be stimulant, antidepressant, and cognitive enhancing. And the reason for that is it contains chemicals, specifically camphor, ursolic acid, and rosmarinic acid, which have those research actions. If we look at Lavandula, then by modern research, it's reported to be anxiolytic, antispasmodic, and anticonvulsant. And this is due to the chemicals, these are monoterpenoid aromatic chemicals, linalool and linaloyl acetate. And we also, with ICM, it's evidence-based. Statements made in ICM courses and ICM books on herbal medicine are evidence-based either on data from modern research or on data from authoritative traditional texts, or both. If we look at pharmacology research example, Ching and Ching's team in 2018 reported that berberine, which is one of the active constituents of berberis, promoted myocardial protection in post-operative heart patients. Now, what's really remarkable is that in 1557, Adamus Lanicerus, who was a German herbalist, he said that berberis can strengthen the heart and relieve discomfort around the heart. This is more than 400 years earlier. Lanicerus was reporting similar effects to Ching and his pharmacologists in 2018. I find that truly remarkable. Traditional herbal texts, the authoritative ones, like Lanicerus, or Tabana montanus, or Gerard in the English, or Dodoens in the Hollandish. These had this information by practical clinical experience. We're now having this justified in modern research. Now I want to talk about research-based herb combinations. And I specialize in making research-based herb combinations. And here's an example, curcuma 1. This is for a very modern problem, obesity, diabetes and hypertension. In Chinese terms, this is for heart phlegm, to clear heart phlegm, and to tonify the spleen deficient qi, which can produce more phlegm. Now, what you're looking at on this slide is the Western herbal structure of this combination. You can see colour-coded the herb actions, the different herb actions. We don't have time to discuss them now. Also, the herbs are classified in terms of temperature, and they're classified in terms of taste properties. That's how in Chinese herbal medicine or Western herbal medicine you make a herb combination and ensure that it's balanced and safe. Now, what I do when I'm making new combinations is this. This is the research table for curcuma 1, which is showing what it does in terms of the available modern pharmacology evidence of these herbs and their constituents. Down the left-hand side of the table, you can see the herb with its constituents. For example, curcuma, one of the main constituents is curcumin. For Rossmorenas, there are many constituents, carnosic acid and so on. Now, across the top of the table, these are the categories of reported pharmacological actions for the herbs that relate to preventing or treating the diabetes, obesity and hypertension. Anxiolytic, hypertensive, hyperlipidemic, reducing the fats in the body, anti-atheromatic, which is to reduce the atheromas forming on the inside of the artery, hyperglycemic and anti-diabetic, anti-obesity, and also included in this antidepressant and cognitive enhancer, because some obese people are not known for their mental acuity. Phlegm slows the mind, not just the heart. Now, if I, and you can't do this, I don't think, on the presentation that you can download, but we have available, I'm just going to demonstrate on one, each of these research references is linked to PubMed, which is the main online system I use for looking at research on herbs. So if I click on one, this should now transfer us to PubMed online. So you can see this is reduced atherogenic risk of patients with type 2 diabetes by curcumin. This is great, and we're trying to work out ways of which we can get this available to you in an online presentation so that you then can have this entire table, and when you click on one of the references, it immediately opens it up in PubMed. Now, this is the first slide of this table, because if I now click on this, we're looking at the remaining herbs in this table. That was the first part of the herbs. Now we're looking at berberis and salvia milturiza, lysine and zingiber, because all these herbs, again, they contain constituents which are anti-diabetic, anti-obesity, anti-hypertensive action. And there are 128 of these, so obviously it takes a long time to make a research evidence table, but it's great because you can justify the herbs in terms of modern pharmacological evidence. So if I go back a few slides, just to say that you must always check with the basic principles of Western and Chinese herbal medicine, you must check the temperature balance is right, the balance of taste properties is right, and the balance of actions is correct. Because if you just put together a research-based combination which you haven't checked for safety in terms of the principles of Western and Chinese herbal medicine, you could have something that makes people a lot worse. Yes, you've got to do the research-based stuff, but you also have to check in terms of the normal safety principles of herbal medicine. So now, this concludes our very brief discussion of some of the topics of ICM treatment. And as I said, you can download the interactive PDF, and then we have some ICM videos for you. First of all, how to use the interactive PDF, which is in 3 sections. First of all, part 1, the introduction, then part 2, which is a case study, which shows you how to use the patient diagram, then part 3, herb comparisons, which show you comparisons of 4 herbs to tonify the kidney, and then we've got the 4 imbalances explanation, which is essential before you try to use the interactive PDF. And for that you see the video, part 1, ICM differential diagnosis, and section 1. Then we have differential questions. See the video, part 1 in the ICM differential diagnosis again, but this time section 1.3. Now, as I said in the beginning of this presentation, I'm getting close to realizing a dream that started for me 45 years ago. But I'm very lucky in now working with a team of people, that's practitioners, lecturers, heads of schools, pharmacists, publishers, and we're all trying to perfect and further this system. And in fact, we're committed to expanding this system into the different specialist areas of medicine, from pediatrics right through to geriatrics. And we're looking for specialists. If you in the audience here are specialists in a particular medical topic, whether it's pediatrics, geriatrics, heart disease, respiratory problems, and you try this system and you like it, then please contact us, because we want to cooperate more and more with specialists in the different areas of medicine. Now, finally then, I'm really asking you to join us. And if you find that this works for you, this system of integrative Chinese medicine works for you in your clinic, then please tell other people about it, whether it's practitioners, whether it's students, so that they can use this system also for faster, easier, and more accurate differential diagnosis, which of course is the foundation for safer and more effective treatment. Thank you.